Good afternoon, Cross Timbers. Today is Wednesday, October 15th, 2014. This is Texan TV News from the Tarleton State University campus in Stephenville, Texas, and I am Andy Barton. Today's top story in campus news: the Department of Rec Sports Outdoor Pursuit staff will be hosting an outdoor cooking clinic on Thursday, October 16th from 3 p.m. to 5 p.m. behind the Recreational Sports Center. The cost is free, and students and all members of the community are welcome to attend the event. This is a good opportunity to learn how to cook over hot coals with a Dutch oven. This is the fourth time the event has been held, once each semester. According to Outdoor Pursuits Coordinator David Myers, the clinic will include how to cook 2 main dishes and a dessert. All participants can sample the dishes. Myers says that most people do not realize how much learning the skill of outdoor cooking can improve the entire camping experience. Those interested in attending do not need to bring any supplies. All the equipment will be provided. The nice fall weather has finally arrived, and this is a great chance to be outdoors and enjoy it. In local news, according to Tarleton.edu, the university will host a disaster preparedness simulation with local responders on Sunday, October 19th. This will be a collaborative effort among students and Tarleton's Department of Nursing, cooperation with Cross Timbers Emergency Response Team, Erath County First Responders, University Police, Care Flight, Red Cross representatives, as well as the Engineering, Psychology, Social Work, Student Health Center, and Counseling Center.
Hi, I'm Lieutenant Alvin Alcon with the Tarleton State Police Department. I wanted to let you know that on Sunday, October the 19th, Tarleton State will be hosting a mass casualty exercise roughly between the hours of 10 a.m. and 1 p.m. For more information, we'll go to Cheryl Hunter with the nursing department here at Tarleton State, who is the program coordinator.
Well, the day of the event, we will begin setting up the simulation about 8 o'clock in the morning. The actual sim part won't happen until 10 o'clock, so the community could expect to start seeing ambulances and hearing sirens about 10 o'clock on this end of campus. And then they will notice the helicopters coming and going. And then that part should be over about 1 o'clock, 1:30. So the sounds and the sights of the emergency responders should be done about then. We started off providing an exercise for our students to participate in, and then we invited community members to participate because we want our students to learn how to interact with their counterparts in the community. And then what we would really like to have happen on the back side of this exercise is that the nursing department become part of the emergency response program in this community, so that in the event of a disaster we can help the hospital and take overflow patients and really care for them. We are all nurses and nurse practitioners, and our building could function as an overflow hospital. So one of the big things we're hoping to get out of this exercise is that designation, that we could help as a hospital overflow in the case of a disaster. Thank
you, Cheryl. I also want to thank all of our citizens for being patient with us during this exercise. We will try to keep the inconvenience to a minimum. We hope that you have a great day, and we hope to learn a lot with this experience.
And now today's Texas national and international news from the Associated Press. In Texas news, former Florida Governor Jeb Bush is campaigning in Texas for his son George P. Bush, a candidate for Texas Land Commissioner. Many questions were asked about the elder Bush on whether his plans were for running for the 2016 presidency. Bush was very non-committal, as he did not want to do anything that would get in the way of his son's political career. Jeb Bush joked with the crowd after his son delivered a speech at Hardin-Simmons University in Abilene, saying he taught his son everything he knows, and yet his son still did better. Jeb Bush is confident in his son's campaign and his ability to handle the task of a land commissioner. Attendees at the event were left wondering if they would be able to vote for father and son in future elections. In national news, a second healthcare worker at a Dallas hospital who provided care for the first Ebola patient diagnosed in the United States was tested positive for the disease. The Texas Department of State Health Services said Wednesday. The worker at Texas Health Presbyterian Hospital was monitoring herself for symptoms. Dallas County Judge Clay Jenkins said the unidentified woman reported a fever Tuesday. She was in isolation within 60 minutes. Jenkins said. Health officials said the worker was among those who took care of Thomas Eric Duncan, who was diagnosed with Ebola after coming to the U.S. from Liberia. Duncan died October 8th. The Federal Centers for Disease Control and Prevention was conducting confirmatory testing of preliminary Ebola tests conducted late Tuesday at a state public health lab in Austin, Texas, which came back positive. Emergency responders in hazardous materials suit began working dawn Wednesday to decontaminate the Dallas apartment of the second worker. Notices handed out to neighbors advise them that a healthcare worker who lives in your area has tested positive for Ebola. It's not clear how the second healthcare worker contracted the virus, and authorities declined to say what position she holds at the hospital or the type of care she provided. We are looking at every element of our personal protection, equipment, and infection control in the hospital, said Dr. Daniel Varga, Chief Clinical Officer for Texas Health Resources, which operates Texas Health Presbyterian Hospital, Dallas. Officials have said they also don't know how the first healthcare worker, a nurse, became infected, but the second case pointed to lapses beyond one individual may have donned and removed personal protective garb. An additional healthcare worker testing positive for Ebola is a serious concern, and the CDC has already taken active steps to minimize the risk to healthcare workers and the patient. The CDC said in a statement, what happened there in Dallas, regardless of the reason, is not acceptable. It shouldn't have happened. Anthony Fauci, director of the Institute of Allergy and Infectious Diseases of NIH, said on MSNBC on Wednesday. Fauci said that he envisioned the CDC taking a much more involved role in establishing the proper training for protocols for Ebola cases. Dr. Tom Frieden, head of the CDC, has acknowledged that the government wasn't aggressive enough in managing Ebola and containing the virus as it spread from an infected patient to a nurse at a Dallas hospital. We could have sent a more robust hospital infection control team and been more hands-on with the hospital from day one about exactly how this should be managed, he said Tuesday. Frieden outlined new steps this week designed to stop the spread of the disease, including the creation of an Ebola response team, increased training for healthcare workers nationwide, and changes at the Texas hospital to minimize the risk of more infections. I wish we had put together a team on the ground the day the first patient, was diagnosed. That might have prevented this infection, Frieden said. The stark admission came as the World Health Organization projected the pace of infections accelerating in West Africa to as many as 10,000 new cases a week within 2 months. In international news, General John Kelly, U.S. Southern Command head, stated that there are concerns of Ebola spreading due to vacationing in the Caribbean and Central America. Many of these travelers will not be screened while traveling through the airports, which is a high concern due to how rapid these diseases spreads. Kelly has sent a military planner alongside a medical expert to Germany to be able to have a plan if Ebola cases start to rise. The fear of another Ebola outbreak is high concern to the fact that many small countries may not be able to handle such a crisis in their home countries. Many families from Mexico send children into the U.S. to escape gang violence, and that raises a concern that families could try to escape Ebola by sending them over as well, which may be detrimental to American society. They are urging that nations keep in touch to avoid any spreading of the Ebola virus due to travel. In sports, bench coach Tim Bogar, the Texas Rangers interim manager for the final 22 games after Ron Washington's sudden resignation, is among 3 finalists for the Texas manager's job. Pittsburgh Pirates bench coach Jeff Bannister and Cleveland Indians bullpen coach Kevin Cash are the other finalists announced. Tuesday. General Manager John Daniels said at the end of the regular season he hoped to have the search completed before the World Series opens October 21st. 5 other candidates were interviewed. Rangers pitching coach Mike Maddox, AAA manager Steve Buechele, Boston bench coach Torey Lovullo, Chicago White Sox third base coach Joe McEwing, and former major leaguer Alex Cora. And now the weather. According to the Weather Channel, tomorrow will have a high of 82 and a low of 55. Thankfully, the wind will be light and variable with sunny skies. There is no chance of rain. Today's broadcast was produced by Michaela Bram, Sarah Sanderson, and Shayla Watson. Make sure to watch us on Northland Cable's Channel 9 every weekday at 12:30. Don't forget to tell your friends about us and become a fan of Texan TV News on Facebook. I am Andy Barton. Tune in tomorrow for the latest from the Tarleton State University campus in Stephenville, Texas.